Controversy tonight over the CDC's COVID-19 death count.
There are claims making the rounds on social media that the number of Americans who have died from the virus is actually just a fraction of what's being reported.
But is there any truth to this? Channel 2 health reporter Haley Hernandez puts it through our Trust Index.
You've seen the images and you've heard the survival stories.
I felt like I literally was going to die. I like to think that I'm a pretty tough old country boy, but it had me crying like a little baby because of the pain.
Nearly 190,000 Americans have died from COVID. Or have they? You might be suspicious if you saw the president retweet this on Sunday, a tweet that was eventually deleted that had a lot of people questioning the COVID death toll.
Did the CDC just lower the number of Americans killed, or have they been lying to us?
Here's the deal. A social media storm claims the COVID death count has been greatly exaggerated all along. That's false. The CDC actually published this data a while ago, showing that 6% of those deaths were from COVID alone, while 94% of the deaths had underlying factors or comorbidities. And while those percentages are true, according to the chief medical officer at Baylor St. Luke's Medical Group, it doesn't mean only the 6% are counted as COVID deaths.
That means the only thing that was listed on the death certificate is COVID-19 or SARS-CoV-2 is the cause of death. The other 94% of the time, there was another condition listed which contributed to the patient passing away.
COVID can be among several factors in a patient's death.
When we fill out a death certificate, we have to put a primary cause of death, but if there are secondary causes that contributed to the patient passing away, we also list that. It could be a comorbid health condition like a heart problem or a pulmonary problem, or a pulmonary problem that was developed by that primary issue.
And Dr. Bigler says people don't always die from the comorbidities themselves. They can live long lives with diabetes or high blood pressure, for instance, but in combination with COVID-19, it can be deadly.
Diabetics have altered immune systems. Those that are obese are more likely to have respiratory issues, as well as, of course, diabetes. That then puts you at higher risk of a more complicated course as you fight through this virus.
And then there are those who claim people who died from injuries and tested positive for COVID are counted as a COVID death. That's also not true, according to the CDC. Right here on its website, it says deaths due to external causes, i.e. injuries, or unknown causes are excluded.
You may have also noticed some discrepancies between the state and local death counts, more than 1,000 actually in the most recent report. That's because the state counts each death certificate with COVID listed as a cause of death, while local health departments wait for a positive lab result before reporting it. So for that reason, doctors say it's really just the most important to watch the trends and not the day-to-day numbers. Don't get fixated on those. And really right now, that's a good thing because case numbers are trending down. The caveat, guys, is that we can't let our guard down now. Labor Day weekend is coming, and the concern is that people are going to get lax with their precautions like masks and social distancing. They're going to gather, and that could lead to a surge.
Yeah, still so many people are questioning the numbers, right?
Absolutely.
I mean, a lot of people have questions. Haley, thank you for that. Thank you for looking into that. If you have a story